Hi, my name is Marissa Mundy, and I'm the Clinical Director at Restorative Counseling Services. We have offices in Buckhead and Roswell and offer sessions online throughout the state of Georgia. We specialize in evidence-based counseling with a strong focus on the perinatal period. And as a women's health provider, you are often the first person to notice when a patient is struggling throughout pregnancy or the postpartum period. Because you see patients so consistently during this time, you are in a unique position to catch early warning signs. And an early referral for counseling can not only improve your patient's outcomes significantly, but also can improve outcomes for baby and the family as a whole. Our goal is to partner with you so that your patients have timely access to highly specialized perinatal mental health care when they need it the most. Now, there's a few different times that we recommend making a referral for counseling. The first is if during the postpartum period, distress is lasting longer than 2 weeks, and you start to say, this is going on a little bit longer than what I would consider to be a typical postpartum adjustment period. The second is if there's distress happening and it's starting to get in the way of the patient being able to complete those daily tasks of living. Or if the patient starts to report scary or intrusive thoughts, these are all a great time to consider a referral. And of course, if there's a difficult pregnancy or birth experience, including miscarriage or infant loss, a counseling referral is essential during that time. In addition to working with individuals, our clinicians are expertly trained in working with couples so we can support them through parenting transitions and the changing family dynamic. Our team is specifically trained in perinatal mental health, and like I said, we work with individuals and couples. We work with everyone from infertility to pregnancy to postpartum and throughout parenthood. And so now you will get to hear from 3 of our perinatal experts about the work they do and the approach they take.
Hello, my name is Victoria Fay. I'm a licensed clinical social worker and a somatic experiencing professional. I specialize in working with women and couples with a focus on perinatal mental health and medical trauma. In my work, I support women navigating fear, grief, intrusive thoughts, and overwhelming emotional experiences. Feelings that can hijack your nervous system and leave someone wondering if there is something deeply wrong or if they need to hide what they're going through. These experiences are common, but they're rarely talked about openly in our professional or everyday conversations. What I want your patients and all women to know is that their feelings and emotional responses are valid. Many women sitting in our offices are suffering silently, in part because our culture tells them that pregnancy and birth should be seamless, joyful, and uncomplicated. I believe that healing happens in connection, and that belief is the foundation of my work. My somatic training allows me to support trauma that lives in the body, not just in the mind, helping clients gently process and integrate their experiences in a way that feels safe and attuned. As a seasoned clinician with a deep passion for women's health, I believe that together with your care and our team at Restorative Counseling, we are uniquely positioned to support your patients and work collaboratively to provide specialized, timely, and up-to-date care to mothers, babies, and families who need it the most.
Hi, I'm Kat Kassman, a licensed professional counselor with Restorative Counseling Services. I specialize in working with couples and women who are in the perinatal season of life. I'm extensively trained in emotionally focused therapy, the gold standard for couples work, which is rooted in attachment theory, as well as a Gottman Bringing Baby Home Educator, which is a curriculum designed specifically to help couples prepare their relationship as they become parents. I've also taken several trainings on perinatal mood disorders with the Postpartum Support International Organization, and I'm on track to obtain my perinatal mental health certification summer of 2026. I offer moms and couples a safe space to share and process some of their most vulnerable emotions and inner thoughts without judgment, but with care, support, and resources. The identity change that comes with becoming a parent is one that is really hard to prepare for, but with the right support, like therapy, we can ease the discomfort that comes with the change. What I love about working with couples and moms is being a part of the village that is so important in raising a little one. As a new mom myself, I can speak to how quality care and support is vital, especially in that postpartum period. When mom and dad are cared for and supported well, we see positive outcomes in not only their relationship, but also baby's overall well-being.
Hi, I'm Julia, and I'm a licensed master social worker here at Restorative Counseling Services. At Restorative, I work with women, young adults, and adolescents here in person in our office in Buckhead and online, and I have a special interest and experience in supporting folks during the perinatal period. My training background is in clinical social work, and I earned my master's in social work from UNC, where I focused on clinical mental health counseling and trauma-informed healthcare. I also have specialized training in dialectical behavior therapy, perinatal mental health, and trauma therapy. In my work, I often use a mix of DBT skills, somatic therapy, and a strong focus on relational counseling to help women and mothers gain concrete methods to manage anxiety, trauma recovery, depression, and any and all emotions that can come up throughout the perinatal period and beyond. What I love most about this work is being able to support clients in a warm, non-judgmental environment and feeling more grounded, safe, supported, and confident as they navigate such a meaningful life transition.
As you can tell, we are passionate about women's health care. If you'd like to make a referral, you can tell your patient to go to restorativeatlanta.com or call us at 678-403-0112. Our intake coordinator, Suzanne, will ensure that your patient is placed with a therapist that's the best fit for their presenting concerns. We look forward to partnering alongside you and supporting women throughout the journey of motherhood.